Hello everyone, welcome to the second Zenith. I'm your host Dr. Arthur, and I'm so glad you're joining me today to talk about something that I think is really important for all of us as we age, hip pain relief. You know, I've been a doctor for a long time, and I've seen so many patients over the years who have been struggling with hip pain, and it's just amazing to me how often it's misunderstood or mistreated. As we get older, our bodies naturally start to change, and one of the things that can happen is that our joints start to wear out. Our hips, in particular, are prone to this kind of wear and tear, and it can be really debilitating. I've had patients who have told me that they can't even walk to the mailbox without feeling like they're going to collapse from the pain, and it's just heartbreaking. But the good news is that there are things we can do to alleviate that pain and get back to living our lives. Now, I know that a lot of doctors might tell you that the only way to really deal with hip pain is with surgery or medication, but I'm here to tell you that that's just not true. Don't get me wrong, those things can be helpful in certain situations, but they're not the only options, and they're certainly not the first things we should be reaching for. I had a patient once, a lovely woman named Margaret, who was suffering from hip pain so severe that she could barely get out of bed in the morning. She had been to see several other doctors, and they had all told her that her only option was to have hip replacement surgery. But Margaret was hesitant, she didn't want to go under the knife if she didn't have to, and I completely understood where she was coming from. So, we started talking about other options, and I recommended that she try some physical therapy to see if we could strengthen the muscles around her hip and improve her range of motion. I also suggested that she try some gentle exercises, like yoga or swimming, to help loosen up her joints and reduce the pain. And you know what? It worked. Margaret was able to avoid surgery altogether, and she was back to her old self in no time. Now, I'm not saying that this is going to work for everyone, but I am saying that it's worth trying. And that's what I want to talk about today, the things that your doctor might not be telling you about hip pain relief. First of all, let's talk about the importance of exercise. I know it can be hard to get motivated when you're in pain, but trust me, it's worth it. Exercise can help strengthen the muscles around your hip, which can help take some of the pressure off the joint and reduce the pain. And it's not just about high-impact activities like running or jumping either. Low-impact exercises like walking, cycling, or swimming can be just as effective, and they're often easier on the joints. Another thing that I think is really important is heat and cold therapy. Applying heat or cold to the affected area can help reduce pain and inflammation, and it's something that you can do in the comfort of your own home. I recommend using a warm bath or shower to relax the muscles, or an ice pack to reduce swelling. And don't forget about over-the-counter pain relievers, like acetaminophen or ibuprofen, which can be really helpful in managing pain and inflammation. But here's the thing, hip pain is often not just about the hip. It can be related to other issues, like lower back pain or sciatica, and if we don't address those underlying issues, we're never going to get to the root of the problem. So, it's really important to take a holistic approach to hip pain relief, and to look at the whole body, not just the hip. I had another patient, a man named John, who was experiencing hip pain that was so severe he could barely walk. But when we started digging deeper, we realized that the pain was actually coming from his lower back, and that his hip was just compensating for the problem. So, we worked on strengthening his core and improving his posture, and that helped to alleviate the pressure on his hip. And you know what? His hip pain started to fade away, and he was able to get back to his normal activities. So, what can you do if you're experiencing hip pain? First of all, I would recommend talking to your doctor about it, and making sure that you get a proper diagnosis. But then, I would encourage you to start exploring some of these alternative options that we've talked about. Try some physical therapy, or some gentle exercises like yoga or swimming. Experiment with heat and cold therapy, and see what works best for you. And don't be afraid to ask questions, or to seek out a second opinion if you're not getting the help you need. At the second Zenith, we're all about empowering you with the knowledge and the tools you need to take control of your health, and to live your best life. And that's why I want to invite you to join our community, and to start exploring all of the resources we have available to you. From videos and articles, to online support groups and forums, we're here to help you every step of the way. So, if you're struggling with hip pain, I want you to know that you're not alone, and that there is hope. Don't give up, and don't lose faith. You can get back to living the life you love, and we're here to help you do it. Thanks for joining me today on the Second Zenith, and I'll see you in the next video.